Hi again, my name is Grace, and this is John Natchvi and Aiden Chang. Over the past few months, we've had the privilege of working with Dr. Daigle and his team to help optimize delivery of high quality and efficient CPR. We are so grateful to our mentors, Travis Laird and Andrea Tomas, for the expert guidance they've provided us throughout this process. Now, as health associates, we helped advise our team on how best to bring our product to market, conducting research on market analysis, competitive landscape, and IP strategy. We're so excited to see the impact our CPR cart will have, not just on pediatric resuscitation standards across Texas, but potentially on patients of all ages around the world. Now sit up and tune in, because you don't want to miss what Dr. Daigle, attending physician in the Division of Critical Care at Dell Children's, has to say next.
What an intro. Thank you to our associates and our mentors for their support of this project. Unfortunately, pediatric cardiac arrest is not uncommon. There's about 15,000 pediatric cardiac arrests each year in the United States, and so survival is only about 40%. And in most hospital systems, the life-saving equipment is typically disorganized or it's inaccessible in carts that were designed decades ago. This can lead to delays in care, delays in CPR delivery, which can cost lives. In addition, there's significant cost to families and hospital systems as well. An average hospital stay after a CPR event is typically about 3 weeks in length and can cost up to $200,000. This inspired us to develop our first prototype, a dedicated CPR cart that's designed to bring the equipment that's needed to deliver CPR right to the bedside, including a step stool, a backboard, a CPR monitor at optimal viewing height, as well as CPR pads and airway monitoring equipment. By taking the equipment that's needed right at the bedside and pulling it away from the large traditional crash cart that's typically found on the market now, this allows for CPR to be delivered much more efficiently and quickly. We implemented this design at our hospital system across Dell Children's Medical Center last year. In a survey of about 200 hospital staff, our cart was preferred over a traditional pediatric crash cart, with staff rating it higher for ease of equipment access, better positioning in the room, and improvement in overall CPR quality. Our team includes myself and Drs. Amanda Perot and Ada Arp, and the three of us wear a variety of hats in the hospital, including leadership within our hospital's resuscitation and simulation teams. We have the unique advantage of being able to actually see the effects of cardiac arrest right at a patient's bedside. We can test changes through simulation and oversee implementation through our roles in hospital leadership. We're now looking to make our design better and share it more broadly. We've appreciated feedback from our reviewers and our mentors. We're hoping to seek expertise in human factors engineering to help improve the design. As far as our market strategy, we know that our purchase decision maker is going to be chief medical and chief operating officers, but we're hoping to explore distribution through a medical device manufacturer. As far as risk mitigation goes, from a return on investment, a typical cart may cost around $1,500, but that same individual cart may decrease the burden of a $200,000 hospital stay due to poor CPR delivery. On our path to market, we're hoping to work with human factors experts to help improve our design. We'll partner with the manufacturer to develop it. We'll test it through simulation. By licensing our product with an established manufacturer, we open the door to a market that's almost 6,000 hospitals across the United States and even more worldwide, with an estimated market price of about $1,500 to $3,000. The benefit of this design is that it's scalable to implement in a single unit or across an entire hospital, adaptable to use for pediatrics up to adult populations as well. We're incorporating evidence-based medicine into a single cart that can decrease the burden of cardiac arrest for all ages. Thank you.
Do you already have an IP on this product?
We're in the process of filing for that.
So when you compare what is currently happening with crash carts and the volume used and everything with this solution, which sounds like it would be in every room, is there a huge price difference in switching the system to this model?
That was part of our return of investment argument, in that it's not insignificant, the cost of kind of retrofitting these old carts, but we felt that we were able to implement this across our entire hospital system for a cheaper product, but it was $50,000 for our whole hospital. And for that investment to actually help improve, decrease morbidity, decrease mortality for patient lives, we felt that that cost was worth it.
So is it the same number of carts as the crash carts, or is it you need more?
It's not a replacement of the current crash cart, it's supposed to augment it. And so that current crash cart is full of all kinds of different stuff, and there's stuff billowing over the top of it. And so this is supposed to help streamline that, so it sits alongside the current crash cart.
So I'm a list. So of course I have to ask, is this specific to peds only, or you can, sort of scale it to adult as well.
Yeah, that's one of the benefits of this is that it's totally adaptable to scale up to adult patient populations as well, because all of the same devices are still going to be needed for adult CPR, including that step stool, the backboard, the pads, and the CPR monitor.